Well, Ebola spreads through contact with the blood and fluids of infected people, but experts say the outbreak is also being fueled by poverty and poor governance. Viewers Steve Baragona has our report.
In West Africa, they are building the facilities to handle Ebola from scratch. Improvised tents house quarantined Ebola patients. Many hospitals in the region lack basic equipment, says Tulane University virus expert Dr. Daniel Bausch. He spoke to VOA by Skype.
You go to a hospital in Sierra Leone or Liberia, and it's not unusual that a healthcare worker will say, well, we don't have gloves or we don't have clean needles.
Poor health systems plague the continent's other Ebola hotspots, too. Bausch says there's a common factor.
All of the large outbreaks of Ebola or its sister virus, Marburg, happen in places where social and political unrest over the years has decimated the public health system.
The war-torn Democratic Republic of Congo has seen 6 Ebola outbreaks. Civil wars wrecked health systems in Sierra Leone and Liberia in the 90s and 2000s. Meanwhile, working in neighboring Guinea, Bausch watched paved roads erode to dirt paths and towns slide deeper into poverty under the weight of dictatorship and corruption.
That period of not responsible government degraded the systems, public health and otherwise, in Guinea, and I think that did have a role in leaving the country open to this sort of epidemic.
And like the health systems, many people in Ebola-stricken regions lack the resources to get by, and that puts them at risk. As they cut down forests for charcoal and to grow food, Bausch says they are driving the bats thought to carry the virus out into the open.
With deforestation, bats that ordinarily would be foraging for fruit within fairly remote areas inside the forest now are forced to come out and look for fruit in the proximity of humans and bring them closer to humans and have more of a chance for introduction of the virus.
And poverty is also driving people deeper into the forest in search of food, including so-called bushmeat, which is known to carry the virus. It doesn't have to be this way, says Dr. William Karish with the Eco Health Alliance, also speaking via Skype.
You see a different approach in Uganda, and you have outbreaks in Uganda, and they have invested in their healthcare systems and they have invested in their education systems. So, of course, they still have these outbreaks, but they're controlled very rapidly.
Once this outbreak ends, Karish says, health officials need to start preparing for the next one with better labs and hospitals and more public information on how to prevent infection. If governments invest in better education and healthcare systems, he says, the next outbreak could be less deadly. Steve Baragona, VOA News, Washington.